Hey, welcome to IOH and Dr. Spooner's podcast as well. We're commingling, and we're here today with Dr. Ashley Spooner. Thank you for joining us, and Jay Dave and myself, Rahul Desai. Um, and today we're going to start off a little bit differently. We're going to talk about how a tree hit my car or fell on top. But literally, so we had an atmospheric river come through Portland a few days ago, and I was driving my son to school at 7 in the morning. It was pouring rain, like we were driving through, huge puddles and lakes to get to school. And then as we were pulling off the exit, I was driving, and I'm like, "Is that tree like moving?" And then it hit the front of our car, and it fell
Oh
on
my
the.
gosh.
Yeah, it was this 30-foot tall um, fir, some sort of like evergreen tree. And then I looked over to the side, all the roots had been pulled up, so I don't know if it was the wind or that amount of rain or what happened, but luckily it was the top third of the tree that hit the car. So there's a dent in the hood, but you know, compared to what it could have been, it was pretty minimal. But yeah, so that
Did you
was
put it
our.
underneath it? Did you put the
Mhm.
car underneath the red light so it could actually the car
That's a
could
great
actually get
idea. I
that
haven't done that
picture?
yet.
You know,
Maybe the dent will
that'd be
just disappear.
that
Paintless,
would just be a
paintless
great.
dent
Wouldn't that be a
removal.
great story? It's like, you know what? I just decided to take this wound that my car just experienced, and I put it underneath the red light. And you know what? I can't see this dent
I don't, I
anymore.
don't think
Like,
Kia has mitochondria. So darn it.
yeah. Uh, that's awesome. We should definitely start this way. Dr. Spooner, any trees hitting your cars or anything going on? What's going on in your world?
No trees hitting my car recently. No, no. It's crazy here. We just have no snow. So we're in Colorado, and normally we're skiing this time of year, and we're just waiting for that to happen. So hopefully it comes soon.
Yeah, we go. It switched with us. We have snow in Cincinnati coming. Came last night and coming tomorrow, and we'll be back in the 55-degree weather next week.
Yep.
So we'll we'll switch. We'll switch then. So how do you both
But
know each
cold
other?
weather is a good time to cuddle up and get some sleep, right?
Hmm.
Good sleep, and that's what we're going to be talking about today. Uh, Dr. Spooner, can you tell us a little bit about your expertise and your background?
Yeah, so I'm a general dentist by training. I have been practicing dental sleep medicine for about 9 years now. I'm a diplomat with the American Board of Dental Sleep Medicine and have really just integrated sleep and overall chronic inflammation into my practice. As a piece of that puzzle, I've just recognized how much of a need there is for our patients, but also for other providers to be able to learn more about what we can do. So I actually also developed Dynamic Dental Sleep and Sleep Thrive Live. Dynamic dental sleep is intended to help with training dentists and their teams on how to implement screening and treatment of sleep apnea within their practices. And Sleep Thrive Live is really my fun part of my job where I get to help to just teach everybody and to make it fun, have it on YouTube, Instagram, and really just trying to bring sleep and overall health awareness to the greater good so that everybody can just be the best version of themselves.
Love it. It's something that's really relevant to all of us, right? We all sleep. We all need good sleep and health. And uh, I actually had this conversation a few days ago, and I think it's super relevant. I'm going to bring it up here. My mom has sleep apnea. She's been using religiously. She uses her CPAP, but hates it. It helps her tremendously as far as sleep and energy and not snoring and all those things. And she was asking me though, she's really frustrated with it, doesn't want to use it anymore, and she's been using it for years. How would she be and I just thinking about you, and I talked to her about this other pathway. And so if someone's coming to you in that scenario, can you talk to me about like what's the it is super relevant, and I'm going to talk to her about it, is what's that kind of the workup? Or if you see somebody like that, I'm sure is that a common presentation for you? And like
Mhm.
how do you move them forward or assess that?
Yeah, so a lot of times, me as the dentist, just with my patient there for their just regular checkup and cleaning. I'm assessing Airway. I look down Airway all day long. And so just by looking and doing my oral cancer screening, I see Airway. And so a lot of that we then tie in with 3D x-rays and just overall the patient's medical history. So if I'm noticing snoring, if there's AFib, if there's acid reflux, clenching and grinding, overall fatigue and malaise, all of these things can be contributing factors. And so the biggest misnomer is that you have to be obese to have sleep apnea, and that's not true at all. This is actually a disease of the collapsibility of your upper airway. And so if there's other things going on, if your jaw structure is more petite, if you had teeth removed via orthodontics, all of these things could be contributing factors. And so us being able to help to identify that and understanding that these could be some of the reasons that people don't feel good and that they can't focus and they're getting sick more often, or many of these different things could be going on, and we could just use a simple screening to be able to help. I utilize many different options for screenings. Of course, we involve our co-partners with therapy, and so medical providers are very important as a piece of this puzzle. I, as a dentist, cannot diagnose sleep apnea, and so I utilize my medical providers to be able to help with that screening. We have different telemedicine options where the patient doesn't have to leave their home. They can meet with the sleep physician via telemedicine appointment and have a sleep study mailed to their house that they can complete at home. So that's really nice. In certain cases, if somebody has heart failure or just a more complex medical history, that may be a reason that an in-lab study would be necessary. And the sleep physician can help to decide what is really the best diagnostic for the patient. Once we get all that information, then if it's appropriate, then the sleep physician will send me a prescription for an oral appliance. And then from there, I can help to fabricate an appliance for the patient. These appliances are very simple. They just fit on the top and bottom teeth. And we have some sort of hinge or support system that helps to support the lower jaw forward. By supporting the lower jaw forward, then that's how we're helping to maintain the airway. And then in many cases, we can utilize that instead of a CPAP.
So it keeps the airway open. So if you've already gone through and now you're at the CPAP stage,
Mhm.
can you track back? It seems like it'd be a lot simpler to put an oral uh, device in, and so is that something that is commonly seen or a request?
Absolutely, all the time. So the stat, actually, I was just at the American Dental Association in Chicago, and we have been talking a lot about how do we help streamline oral appliance therapy for our patients, and also how do we make it more affordable by really collaborating with the American Medical Association. And so with that being said, the stats that came up is that only about 20% of people are compliant with a CPAP after a year. And so we start to think about the severity of sleep apnea that we're treating. And if our patients can't tolerate that, even if an oral appliance may not get us to our prime perfect number, if our patients are wearing it all night, every night, it's actually shown to be just as effective as a CPAP that may only be worn 4 hours a night and maybe a few days a week. And so that's something that's very simple for us to do. I will communicate with the patient's physician, and then we get them into an oral appliance. What we always do when a patient's wearing an appliance is that we will do a follow-up sleep study, and they wear their appliance and we determine what is the effectiveness of that appliance. That helps us to then determine, do we still potentially need to utilize the CPAP in conjunction? In more severe cases, sometimes we do. However, we can make it more comfortable because we can now reduce the CPAP pressures because we have the appliance helping us also. Then there's other options of different laser therapies as well. And so I actually do night laser therapy in my office. This is a great adjunct as well. So what we're doing is we're stimulating soft tissue with laser, and we're not cutting, there's no downtime or anything like that, but we're stimulating collagen production. And by doing so, we're able to tighten up the soft palate, we can tighten up the floor of the mouth, and actually help to reduce tongue size so that we can open up the airway space as well.
Yeah, cool. I had that done, and it was awesome. It kind of wore off now. It's been, I don't know, a year, but at least maybe more than that. But really, really, I noticed almost immediately that I stopped if I sleep on my side, I don't snore, but if I sleep on my back, which I usually end up in that position, then I'm snoring, or I wake myself up even snoring. And that it went away for about 6 months.
Hmm.
I noticed a dramatic improvement, and it was uh, a testimonial to the procedure. Man, it was super easy. I mean, it took maybe 3 minutes or 4 minutes, and virtually no, like a little bit of tingling, a little bit of warmth, the back of the throat, but I didn't need any sedation or anything. It was super cool.
Hmm.
So,
Yeah,
um,
it's really nice. And you're exactly right. So we're about every 6 to 12 months, we just do a touch up,
okay,
and that helps people to continue to maintain long term.
perfect. So it's not a failure of the therapy. It's just that it is an ongoing maintenance type of
Correct.
process.
The benefit of this therapy, there's different lasers that will do this. A CO2 laser will also do this. We're just using different wavelengths. The benefit of that is that we are not doing something that's irreversible. So we're not creating scar tissue. Same with the U-triple-P procedure. We see a lot of relapse after that type of procedure. And a lot of that, again, is just as we age, our collagen is just not what it used to be, and our tissues start to get a little flabby and floppy. So, um, with that, now with this type of laser and continuing to stimulate the collagen, that's what we're helping with. So, much like red light therapy can help with
Well,
that as well, it helps to be able to maintain.
yeah. So I mean, it's a nice segue. What do you think about? Well, that's how we got introduced. Well, I was lecturing on regenerative medicine and photobiomodulation, and we got to connect and have been talking since then. And so, tell us a little bit about your or let's start talking, you both of us, about photobiomodulation, and you've been using it now, kind of at home with family, and I don't know how much integration there is currently with the practice, but uh, what are you experiencing with kind of the LED in clinic and at home photobiomodulation?
Absolutely. I started off, so my same laser that treats sleep apnea in the office and snoring, I can do photobiomodulation on a small scale that way as well. But then learning, and after meeting with Raul, of learning that, oh, you could do this at home, and I can have my patients have this at home, and microdosing and getting to do it way more often than what I can do in the office. That's been amazing. And so a lot of my motivation for that currently is my mom has Parkinson's. And so I am always researching and always finding what are some alternative support mechanisms to just help her have the best quality of life that she can. And to, of course, fingers crossed, help to delay the progression of her disease. And so we've really started with helping with her of sleeping. She utilizes the red light morning and night, and she's sleeping much better. We also have protocols where she is shining the red light on different areas of her head to help to get to her brain. And so all of these things are intended to just help to continue neuroplasticity and just keeping her going. We've noticed great results with that. It's really helped overall anxiety as well. Her tremors are better, her pain is better, and she's been able to use this even down to her feet where she has some neuropathy as well. So it's been really neat to see, and she's stayed consistent with it. So that's also a good key of that. Clearly it's doing something, otherwise she wouldn't keep doing it every day. So it's it's
Beautiful.
very awesome to see what's happening, and even people who have seen her recently who haven't seen her in a couple of months have said, "Hey, you're different. You look different. You're more stable. You're not shaking as much. You're just different." Her presence is more like how she used to be. So it's really neat to see.
Amazing, love it. Yeah, there's I was just for uh, our conversation today, just briefly looking at some of the more recent studies. And so they had a couple of them with at home LED devices with Parkinson's. And they did one was a 5 year um, study, so pretty long term, where they were doing uh, photobiomodulation with LED based systems and using that mostly transcranially. And so, like, front of, where there's not a lot of hair, Mia
Mhm.
to go anywhere, but for folks, kind of frontal temporal regions, and really stimulating kind of overall brain health. And like you talked about, energizing with, ATP, mitochondrial efficiency, and better blood flow, and you're going to get to those deep, with the Parkinson's obviously folks, the substantia nigra, so it's pretty deep, these deep structures. But by even simulating some more superficial structures, you get better blood flow, and it can affect the, kind of remotely as well, as we're learning with photobiomodulation. But there's some other, really interesting studies around those neurodegenerative conditions, and then also sleep, because I think, better sleep, as you'd say, is going to affect all of these conditions. And how long has she been using it now? A couple of months?
Yep, it's been 2.5 months.
Okay. I mean, that's, I think, the experience, even just personally with, uh, my transformation with PBM is, you continue to see these cumulative benefits, over time. And I think for me, it kept going even today, but I think, I'm more at a steady state, but that improvement, like that was 6 months to a year of, like, my body wasn't doing the things it needed to do to maintain, especially for me, like collagen production, energy, pain, those things. And so I think she'll, that's my preference. She'll continue to see, even continued benefit and upslope of her symptoms.
Hmm. Absolutely. I've now with a lot of my patients, so sleep apnea, of course, is a major piece of what I treat, but we recognize that sleep apnea isn't the only sleep disorder. And so many times patients can have many sleep disorders all at once. So insomnia is one of the leading sleep disorders out there. And so being able to use something like this for circadian rhythms and to help patients to actually calm down before they get to bed. We're avoiding blue light and doing all of these things to aid with sleep hygiene. But I think having this type of panel available in home is something that's extremely helpful, not only for that patient, but I always tell my patients you can utilize this for your whole family. So you get a big bang for your buck that way versus them coming in and paying me to do a couple of spots every few days. That starts to add up pretty quickly. And so it's just such a great resource for us to have. And then on top of that, being able to use it for pain and healing and after surgeries and jaw pain and all of those things has been extremely helpful.
There was an interesting study that kind of tied in some of and I have some questions about the study too. I want to dive into it, more, but they did a study on just recently, it was published in May of 25. They did about 60 nurses that were night shift workers, and they wanted to, all complaining of sleep issues. Obviously, that's your circadian rhythms are completely, jacked up and having all kinds of problems, and it's a tough job, right? So night shift nursing is challenging anyway. And so this study used LED right? I believe it was LED. It was photobiomodulation, and they illuminated their hands and areas of pain. So it wasn't even transcranial. And so the goal was to reduce areas of pain and then see the effect on sleep. And they did recognize in the study that, hey, this could also be producing some other systemic effects. They did not cover the eyes, so there was illumination of the eyes as well. So like these different pathways that are working, but they did show about a 30% decrease and it was just, I think, 2 or 3 applications a week for 4 weeks over the hands and any other areas of pain with photobiomodulation. And there was significant, statistically significant and dramatic reduction in both pain and improvement in sleep scores. And they used
Hmm.
wearable devices. So it's really interesting. And we talk about these different mechanisms, like say, with we treat sleep apnea or insomnia or what is this poor sleep because of say TMJ or some other issue, even myofascial or musculoskeletal anywhere else. And then there was these benefits. So I think what was really interesting was there was both pain reduction, which we're using it, for in many different arenas. And then there was also this sleep. And was it a one-to-one directly, you're letting less pain and you're sleeping better? Or what is there? I think there's probably a more complex mechanism behind that, yeah, pain is improved. And that's awesome. So, photobiomodulation helps with pain and inflammation, but also, hey, that we're starting to see sleep improvement. Uh, and I think that's really interesting because a lot of the studies still will go transcranial and assess that. But that was something that was recently done. There was another one with insomnia, um, and you mentioned that as well. And that study was transcranial, they used laser LED, but low level laser therapy. So we'd be able to get the same effect with an LED device. And this is 4 to 5 minutes frontal lobe and temporal areas. And again, showed dramatic improvement in insomnia symptoms. So kind of sleep latency, getting to sleep, staying asleep, and then also daytime fatigue and sleepiness. All of those improve. So pretty cool studies that are now really coming out. And I think with the kind of the proliferation of at-home units, that we're seeing more interest in, like, hey, how does that actually affect our body?
Absolutely. I think the one piece too then that I tell my patients is, of course, that it's so important to know what type of red light you're getting. And so
Mm.
I talk about, you can go on Amazon and of course there's going to be things that are way less expensive. However, is it just a light that's red or does it actually do something? And so I think that's a big, big piece of the puzzle for patients to know. And anybody starting to look at something like this is just making sure you know what you're getting. And sometimes you get what you pay for at the same time.
Absolutely. I mean, I think that's one key point also, is the near infrared, the light that we can't see, right? That is really powerful, the energy that we can't see in that. So, when we look at a red light panel, say a red light panel, when you turn that on, or many of them and that have red and near infrared, the near infrared, kind of to the naked eye, you'll see very faint light, or you won't see anything. And so, but that there's still energy emanating from the device. And for a lot of the things that we're talking about, today with neurodegenerative disorders or things that we want kind of deeper penetration, we need that longer wavelength. So if we just focus on the red, that might have some good effects for, the retina, and it may help with some, like, obviously, like skin and more superficial structures, and maybe secondarily will help with some deeper things, but it's not going to have that same effect as the near infrared. And so that's
Mhm,
where you want to make sure that we're actually using the right medicine. So those wavelengths are really, there's some key wavelengths even within that spectrum that are a little bit more powerful. But when you look at devices, or if someone's, looking at making sure that they get the right medicine, it's in that 600 to about 900 nanometer wavelength. That's really gonna, that especially at home, that's really gonna help us with all the things that we're talking about today. So as
mhm,
doing kind of their research, they want to make sure that those are the wavelengths that they want to use. And how powerful is the device, right? So that's the medicine. We talked about this before. You want the right medicine, but then what's also super important is the right dose. Right? If you're taking an Advil, everybody knows Advil, right? If you're taking Advil, or and you take 1 milligram of it, it's not going to do anything. You need the 200, 400, 800 milligrams. You need the right dose. And the same thing with light. Light is medicine. So we have the right medicine. You got to have the right dose. And dose depends on how powerful or bright the light is, and how close it is to your body or your tissues, because there's a dramatic reduction in what our body is receiving when you move the panels away, and then how long you sit in front of it. And so that's where, kind of clinicians, doctors, trusted wellness advisors are. It's really important, or you have the right kind of protocols and education. And so that's where, Dr. Sweeney, you're going to step into their lives and help them, educate them, and help them through that process. Have you seen any, like, obviously with your mom's story, that's amazing. Have you started yet clinically, or um, with an at-home device product, or what's your thoughts on moving in that direction?
Yes, we're certainly open to it. So I'm also starting to do PRF for TMJ injections and help with regenerative medicine that way and alternatives to surgery. I also do a lot of surgery and implants and extractions myself. And so I utilize photobiomodulation in my office. And so that's definitely something that we're open to also adding for our patients to have the full effect of being able to take that home, to be able to pre-dose before having surgery and have the ongoing effects from there. I think just knowing just long term what this can do even beyond just a surgery is the true value of having something like this in your house. When we first got the panel for my mom, I had it first, just timing wise. That's just how it works. So I got to have it in my house for a couple of weeks, and so I used it. And then when I had to give it back to her, I was like, "Oh, I need this back. I want one here in my own house." So I think that's just my own of being able to experience it. That energy carries on to my patients of how much I believe in this as well, and how much I know that it can help them long term.
Yeah, is there a, one thing that when we started talking to a lot of the dentists, and I'm a skeptic, right? That's kind of, I'm a skeptic at heart, and looking at
No,
the,
you're not a skeptic. Come on.
yeah, well, I mean, I'm a sucker too to buy stuff, but I'm a skeptic.
I'm
Uh, I like toys. The But one of my big concerns was when speaking to kind of the dentists, even for TMJ, especially implantology. Some of the things that we were looking at is like, are we going to get enough dose? Because I think there's a lot of, and I'm wondering like how much of that is, I'm sure it is in the dentist's mind. So you have that discussion in the surgeon's mind. Is like, are we going to get the medicine there? Right. That
Mhm,
that to me was probably the biggest question. And when because you have a lot of experience in using photobiomodulation and using lasers and things like that, but a lot of it's intraoral. So you're getting, the device, you're putting it right on the tissue that you're treating in the mouth, on the gums, on the periodontal bone, or so the um, I think there's that disconnect or maybe disbelief. There was for me is there, are we going to get enough in there, right?
mhm,
By shining a light on the skin, like how much attenuation, how much is going to get scattered and dispersed and not get to the deeper tissues. And so I did a lot of research and reading about this. I thought it was really fascinating. Some of the both animal studies and human studies on delivery of this light therapy from the skin getting into the mucosa. And, has to go through the skin, the fatty tissue, the mucosa, then to the gingiva and to the bone, especially for
mhm,
implantology and orthodontics as well. So like actually moving teeth, it can be very helpful. But uh, so for the answer is yes, it can get there. There's a dramatic reduction. You're losing about 80%, 90% of the energy into tissue. So that's the attenuation. But the amount that gets there is significant. With a 5 to 10 to 15 minute dose, and then you start adding those AM PM, and you actually quickly outpace what's done in the clinic.
mhm,
And studies, what was interesting, I'd love to get your perspective on this and how it implement the studies that have been done with photobiomodulation. They're delivering all of this dose, but it's really early, right? So they come in and then you have implant and then a couple of sessions of high dose energy deposited into it. And the study showed like, hey, there's a lot less pain, better reported scores. And then it waned. It's like, of course it waned, and it showed the difference, but then, they matched over time because they weren't continuously dosing. They didn't come back for more because that's challenging, like to bring them
mhm,
back to the office. And so looking at those studies, it's like, well, what if we kept dosing them? Right? What if they were getting these microdoses, even if it wasn't as large and focused as having an intraoral laser device, but you were still getting that? And if you look at even the 10% of what the skin dose is into the periodontal bone, that you're going to quickly outpace that. And over time, I think we're going to get a lot better outcomes, less failures, better bone incorporation, say with implants, or better surgeries, less wounds, less failures, less infections. And the other piece of it was the animal studies, were showing when they did some implants where they sacrificed the animals at like 6 weeks and they did LED based sessions extra orally. And they showed that the bone incorporation, I guess these are all new stuff. I was learning all this, like BIC is a score. So like bone integration coefficient or something, or
mhm,
percentage. And so how much bone is actually, attaching to the implants. And there was a significant difference with PBM. And that was extra oral, right? That was like on
mhm,
the skin for these animals. And then they had, unfortunately, the sacrifice animal look, and they did that was a controlled study. So with the light, without the light, that there was a significant difference. So I'm more and more not skeptical that, hey, we would done properly, right? And then we have to get all the studies. They're not out there right now, right? So that those kind of that metadata, which we would love to start looking at. What are your thoughts on, as I throw all that information at you? What do you think about um, clinically, like being able to do this and how we would measure it and like what things we'd be looking for.
Absolutely. So I actually just had a patient who I saw yesterday, placed an implant 4 months ago, and she had history of osteopenia, just overall just not healing very well, some diabetes that was well managed and controlled, but she had always been told you can't have implants, you're not eligible. Her medullary bone was not very dense, especially in the mandible. And so we knew going into it the risks associated, and she still wanted to try. And I'd let her know, hey, I have this technology, photobiomodulation. I'd really like to see if we continue to dose this and if we continue to treat you once a week while you're healing, what that could potentially do to help you to have this implant. And so I placed the implant. Ideally, when we place an implant, we'd like to have primary stability at 35 Newton centimeters. For this patient, I got good torque. However, then it loosened up a bit. So I was about 25 Newton centimeters. In cases
Can you
like
tell me
that,
what
if,
that's? Can you tell the listeners
yeah,
and myself what that means and how
that's a
you?
torque. Yeah, that's a torque value of our implant in the bone.
Okay,
And
so you're
so
you're testing it with like a
exactly.
drill.
Essentially a
Or,
screwdriver or our drill. Yep. Our fancy drills. Um, Once we hit that, so it's 35 Newton centimeters, that's the golden egg. That's what you want to hit. In certain scenarios, maybe we don't hit that. In this scenario, we kind of knew that maybe that wasn't going to happen. And we had talked about that in advance of, I'm happy to give this a shot. Let's see what happens. Let's sit in there and let's do photobiomodulation. So I buried the implant underneath her gum tissue so she couldn't put any pressures on it, anything like that while it was healing. And she came in for photobiomodulation once a week for those 4 months. And we opened it up yesterday and I torque tested it and it torqued to our 35 that we needed. So she gets to put a tooth on top of it. So that was just a great example of a patient that may not have integrated had we not done something like that. She had history of implant failure in the past. She was told she couldn't have implants. We utilized this type of therapy to be able to help her. I did think for her that had she had a panel at home where she could also be microdosing even beyond the once a week she comes into my office, how amazing that would be and how that could help her just overall with her overall health. So I absolutely think that those are things that if we can start to incorporate that and just make that part of the care and part of our treatment plan, that's great. The hard part is depending on the different workflows in the office that somebody may be in, is how do we take this chair time to be able to do all of these different steps? So for me, even starting to incorporate laser, and I utilize lasers to do my extractions and decontaminate sites and do all of that, it was a change in flow that at first it took me longer to do my extraction that way. So it makes you think as the clinician when you have to see a certain number of patients in a day, well, is this sustainable? Can I take longer to do this? What I can say though is since I've been doing the protocols I have, my 2 week post-ops look like 1 month post-ops. My 1 month post-ops look like 3 month post-ops. So I'm accelerating that healing. It's almost like my insurance policy that I know that my surgery is going to go well, my patient's not in pain, they feel good, and we're going to have an excellent outcome. So that's the reason for me of why would I spend a little extra time on the front end to be able to ensure that I can have that outcome on the back end.
That's great. I think you sort of answered your own question as well, because when you have the patient start to use it at home prior to the procedure and then go back home and continue doing it day in, day out, morning and night, you're not taking any more chair time, And so the thinking about how do I fit this into the workflow, you don't have, the beauty is you don't have to, because this is one thing that can happen when they're not taking extra chair time, even in the workflow. Granted, you are doing it in the office as well, but even if it was not to be part of the office experience every single time, it was maybe in the beginning or at a different point. The big thing is that they have it at home when they go home anyway. And when they're actually using it in parallel, um, it's not taking away any time from the, in your workflow.
Exactly. You especially think of some of these we treat like in Planus, we treat dry mouth, we're doing all of these things with photobiomodulation, but a lot of that requires that patient to come to my office 2 to 3 times a week for 4 to 6 weeks. That's a lot of time.
Yeah.
And so, and then it becomes quite costly because they're having to come in for that time, and then that's our chair time as well. So there's great applications for that. If the patient will follow through and be consistent at home, there's just so much they can do with that. And then I tie it back into it's the gift that keeps on giving, because now once you've
Yeah.
resolved that, now you can keep using it, and your family members can use it, and it just keeps going. It amortizes very quickly.
No doubt. That was our experience when we started using it for regenerative medicine. Uh, we initially started because we were a little bit concerned on cost. Started kind of a rental program, and that quickly after a few months went away because nobody returned them. They literally
Yeah.
they kept them because they loved what they were feeling, and then a lot of them, their spouse or their kids or somebody else was using it. So they
Mhm.
had to see that they could call back and say, this is like really helping with my pain. And we were treating joint and spine uh, injuries and pain and degeneration. So, who doesn't have that as we're, aging? And so it was just really nice to see other folks use it. And then a lot of comments were, man, my skin looks a lot better. I feel a lot better. And getting comments from other folks. And so we just didn't get them back. And the other piece of it, and I don't know if probably based on your practice and what you're doing. And we saw a lot of patients that were remote from us, and so we would see patients from across the country, and they weren't able to come back because a lot of our protocols also included shockwave therapy. So they
Mhm.
come in and do a couple of sessions before, like preconditioning, and then 6, 8 sessions, and they would come in once to twice a week for shockwave, which can stimulate, works on a cell level as well, and helps with healing and pain reduction, better, tendon, ligament, bone regeneration and healing. And but if you live 2,000 miles away, you're not coming back every week. And so this was something that was really nice that we would kind of drop ship the devices to their home. They would start a couple weeks before because they knew they were coming in for the procedure and kind of get primed for it. And I could see how that, especially with more, with maybe the patient that is in a little bit of poorer state of health, like you were saying, or has these kind of predisposition for potential failure, or obviously if they're coming in for implants or a lot of dental work, then that oral cavity is probably not the most healthy place in the world as well. And I think that this can help. And even some of the studies have shown improvements in like microbiome and kind of the overall just supporting the tissues to be a healthier microenvironment and milieu for whatever thing that you're doing. So I'd be excited that maybe on our next podcast to see if there's more integration of that. But you're talking, I'm an evangelist that every person that has a cell that has a mitochondria, right? Not the Kia car, but everybody else living or even animals that they deserve the power of this light.
Yes, absolutely. Completely agree. I think I I look at that as far as my sleep practice, and just the difference that I see already by treating sleep apnea, and that gives me such a purpose in what I do. I quite honestly just got bored with the regular general dentistry things after a while. It just becomes second nature and just easy to do. And this just has given me so much more purpose to see how you truly change somebody's quality of life just by helping them to sleep better. And not only their quality of life, but their spouses and their family members as well that are also affected by this. And having something like this to be able to support them. And we talk about early onset Alzheimer's and dementia associated with sleep apnea and gum disease and all of these things. This is just such a great supportive adjunct to daily life to be able to just help them to improve their quality of life and just overall longevity.
Did you see
You know,
that
it's
study on? Oh, sorry, Jada, go ahead.
no, my comment was going to be, it'll be interesting when we bring you back on, after you start to incorporate it, or when your patients start to incorporate it at home, taking it home as part of your your treatments, what results you see, especially since you're already seeing the acceleration of healing just by doing it in the cadence that you already are. So I'm just fascinated by that,
Mhm.
and what you know and what kind of results you'll see after. Go
Yep.
ahead, Raul. Sorry, I don't want to interrupt.
Oh, I was just more on this, but I just find the science fascinating. On we had talked about it before, the kind of this brain waste removal system. Could you had mentioned
Hmm.
how important sleep is to all of this, and I don't think we recognize um, the importance of that. And I actually, I'm playing around with. I got this trial of this Whoop device. I don't know if I like it. My forearms are too hairy, and hair, so I don't know if that could be. I love the data that it's giving, but it's not the most, like, I'm kind of debating whether to keep this or go to like the Aura 4, which
Yeah.
is pretty cool too. But I think
Yep.
it's really important to look at that sleep data and how it can fluctuate. But the uh, that brain waste removal system. Can you talk to us a little bit about that and how? I mean, are you especially with your mom dealing with those things? And I feel like you know I've seen in my family and others that are close to us is it's kind of right now we're all not too dissimilar in age. I think it's really important that we start as early as possible. I even look at my kids and say, okay, sleep, and trying to ingrain in them how important sleep is, and they'll pull all nighters to study and do all kinds of things. And I know that at least they're a heck of a lot more resilient and they have a lot longer timeline. But I think it's as we move into this like kind of wellness generation, and I think we see it everywhere. Health and fitness, and I'm super into it. And maybe I just see it more, but it seems like there's a massive trend towards that. Can you speak to us about kind of the importance of sleep? I think we minimize it. And we hear about it like sleep's important, but I think it's absolutely foundational and critical.
Absolutely. And so we think about staging, and I think tracking sleep is amazing. Whatever type of wearable we have, I think is great. As a part of some of the things that I do with Sleep Thrive Live is I just try certain things and I report on what happened. Or I took this peptide. I'm tracking my sleep. I drank wine last night and this is what my Aura ring told me today. All of those things of what does that look like? And it's amazing. So just taking wine as the first example, that is something that majorly can affect both REM and deep sleep. And so everybody's a little different. I've had my cousins as well as my husband do experiments of, okay, so exactly how much can I have and not have it affect me? And some people can have a full glass, some people can have an ounce. It's very interesting of how everybody's body just reacts differently. But really the side effects of all of that, whether it's alcohol or it's caffeine or it's you ate a processed meal or you ate too late or you exercised too late, all of these things can affect all of these cycles. And when you're not getting into these proper sleep stages and you're not staying in them for their proper duration, you're really affecting the long-term effects of memory consolidation, of anxiety, depression, of your leptin and ghrelin that's now affecting how your body processes food. Do you feel full? Are you still hungry? Are now you overeating? Even all the way down to insulin resistance, and then to your heart rate and overall how your heart is responding. So there's so many things that happen in your deep stages of sleep. In 3 sleep, you have what's called the glymphatic system. So that is the brain waste system. I call it the brainwashing function. And so every night you want your brain to wash itself and you want to get rid of the amyloid plaques that are in the brain and tau proteins. When these start to build up time after time, so you think of that night that you didn't get good deep sleep. Maybe you even just went to bed too late, and so that's why you didn't get good deep sleep. Well, now you didn't have that function of those proteins washing away from your brain. When that builds up time after time, night after night, that's what's leading to early onset Alzheimer's, dementia, and other neurodegenerative disorders. Same thing when you have REM sleep. Maybe you're forgetting things more recently. Your short-term memory is not great. You're on edge. You're just not interacting with others well. All of that can be a function of REM sleep. And now you're affecting that long term. You actually can't make up sleep. And so when you've lost it, it's gone. And so over time, that does start to cause problems. So there's so many things, like Raul just said, of how much sleep is important. It truly is a vital sign. And so that is becoming more of a common thing in the medical world as well, is that sleep is part of what we evaluate. It is a vital sign. It's a part of social determinants of health and how we're affecting overall quality of life. And it's definitely something we have to pay more attention to.
Have you tracked or have you used the at-home PBM enough to track any of the? Because I noticed that's the first thing I noticed when I started doing uh, red light, near infrared light therapy. Either in a big bed that I was using, 8 years ago, 9 years ago, or the at-home device. That if I use it on a consistent basis, and it doesn't take me very long. Sometimes it's that night. It's like the anti blue light or anti wine. I don't drink, but it's if I don't do the red light, I will notice that I will have 20% less deep sleep.
Mm-hmm.
REM will be less. My heart rate variability, one of the other measures of kind of parasympathetic tone and healthiness, that will be reduced. And then if I'm consistent, those are prime, because I don't need as much. Like, maybe I do need more sleep, but my sleep, the one metric it keeps dinging me on is the time.
Mm-hmm.
I'll ask you that question. So and I feel good. Like, I literally wake up and I cannot go back to sleep, but I'm probably around 6.5 hours. Um, and I'm 51. But what is your thoughts on? Because it's like you need 8 hours, and now I'm just like this whoop ring. I'm like, every day I'm going into a deficit, and I'm just this huge bucket.
Exactly. Studies show that the average adult should get 7 to 9 hours of sleep. And so I know it's hard. There's also another stat out there of that if you have to use an alarm to wake up, you're sleep deprived, which I'm like, oh, great, I'm sleep deprived then for sure. I think that's the hardest part. When I had the light here in my house and I was using it consistently, absolutely my deep sleep was increased. My heart rate variability was much better, and I saw that within one night. And I even tracked it of, okay, I'm not going to use it tonight and I'm going to see what happens. Sure enough, it would go down the next night. And so extremely interesting of what that looks like. The other piece that I personally just experienced, and people would ask me, well, how do you feel now that you've had this? And it was an indescribable feeling of just, you feel the energy going inside of you and you can feel it you just feel so much better. I would use it in the morning before I would go to work, and I start to see patients at 7 a.m. So I go to work very early. And it was just something that I would do while I was making my coffee. I have it on in the room and I would just have that going. And I was so much more ready to go even before I finished my coffee than I was before I was using it. And so there's definitely so many things that it does that really it's almost inexplainable, of you don't really know how you feel, but you just feel so much different and better.
Yeah, there's a very spiritual component to me for it. Like, after understanding the why, we talked about that. Maybe for your listeners, anybody that's new, I find super cool is kind of the why. Like, why in the world does red and near infrared light do anything? Right? I mean, we know now scientifically, and as physicians and scientists, I like the mechanisms, but the why I think is fascinating. Is that you know we've been humans for 400,000 or 500,000 years, and our cells have been you know uh, kind of unicellular organisms for trillions of years, and the sun has been the constant, right? That's the sunrise and the sunset. That's what gives life on this planet. And every morning, that first -5 to 15 degrees, that light that comes through, it has to go through a really long path. And so all of the blues, ultraviolets, the high energy gets scattered. And what comes through is the red and near infrared. So it's a signal. And at the end of the day, it's that same signal when it's going down. So our bodies have been, our cells, like our mitochondria, our cell, every piece of us is tuned to that. That's a signal. It's like a light switch, on in the morning, off at night. And there's biologic processes that occur. So in the morning, when we were crawling out of the caves and getting out from under the trees, that energy was filling us and telling us to get up, produce ATP, get ready for the day, like a stimulant, right? And then in the evening, that same light is what's telling us to go to sleep and rest and repair and heal from the trauma that we had, during the day. And the modern day studies are showing exactly that, which is super cool. When they are doing bench research and scientific evaluations of how mitochondria act, it acts differently in the morning than at night. Right? There's different processes through the day. We're also seeing that the mitochondria, like our cells, when they're injured, like healthy cells that have lots of mitochondria, they can actually donate those powerhouses, those energy cells, to the other mitochondria that are injured. And so it's just fascinating that this is something that's evolutionary biology that we're now being able to harness in this simple like panel to take it home and then use it properly. But I feel the same way. From Thanksgiving, we were gone and, came back, and I even probably took a couple more days where I didn't get back into my habit of red light. And I started just feeling some aches and pains, and I was like, well, wait, it's plane travel and fatigue and eating too much food, and probably there's some of that. I ate everything that was in front of me, and but I got in front of the light. Jay, it was amazing. I got in front of it for like 20 minutes, and then I came out of that. And I was talking to my 7-year-old, so I was like, I feel so freaking good right now. Like I just felt like energized and warm, and I didn't have pain. I was like, oh my gosh, this is so. I forgot how good it felt. It was been about 10 days that I had
Mm-hmm.
not done it, and it was pretty amazing to feel that when I missed it, I felt that energy and just that kind of indescribable feeling. And that's why I think once people get in front of a proper, and I'm biased, I love our Red Vive panels, but a proper, well designed unit that's delivering this type of energy, it's inexplicable. Like you will feel it. And it takes maybe one time. Right. So that's
Mm-hmm.
cool.
Absolutely.
So that's my spiel and excitement.
Have you seen
So
correlation between diet and sleep? Because I noticed that when I eat in a certain way, for example, if I eat more veggies, I drink a lot of just green juice and process little food. I eat maybe one meal a day. If uh, if I eat a little bit more, it depends. But I need less sleep when my body is already processed the foods that I've actually eaten, and so and also depending on when in the day I've eaten, so I have a lot of energy. So when it's time to go to sleep, I go to sleep, but I'm in a restful state, and I don't feel that if I eat steak, if I eat meats, then my body is now trying to process the meat. If I'm staying in a more of a vegetarian diet, then my body, processes it faster and and so I'm able to utilize energy differently. Have you seen that
Mm-hmm.
experience?
Absolutely. And everyone's different. Adults in general are not intended to have a lot of dairy, so we grow out of that as we age, and so that's a big one. I personally love milk and cheese, so that's a big problem for me.
Oh, I
But
love it.
so these are all things, and also timing of when you're eating. This also a thing for me. I work really early in the morning, but I also work late at night, and so sometimes I'm not having dinner until 9 or 9:30 at night, which is horrible. And so you can definitely tell a difference in those types of things because exactly what you just said, your body's focusing on those processes versus now the restorative sleep that it should be getting. It's distracted. It's in a more fight or flight mode to take care of that before it can actually go into your parasympathetic mode and take care of just taking care and restoring the body. So all of these things are so important. I always tell my patients, we want to help you to have your body work for you and not against you. We already have so many environmental factors and stresses and all these other things. We want to control whether that's the oral microbiome, the gut microbiome, just whatever factors we can control, keeping your airway open, having all of that is going to help the body then take care of itself. We've seen this, and there's actually a study of a patient that was bedbound, over 700 pounds, severe sleep apnea, was put on a CPAP, and within 2 weeks, without doing anything else, was still bedbound, lost 150 pounds. All they did was start wearing a CPAP. And so just simply giving the body oxygen and allowed the body to start to do other things and start to process. So it's the same thing. What we put in our bodies is so important. What we're doing, what we're eating, all of that is helping our body to then take care of itself. There's all these things out there you can go buy. There's no easy button, but if you'd actually just get back to the whole foods and do exactly what Raul said of go outside, go actually see the real sunlight. Those types of things will actually really help your body and help just overall how you're feeling and your mood and mental status, everything.
What do you what is the timing on I'm just wondering, like that's this stirred something because we eat late too. Is there any scientific information? It's like how much time do you need to get into that? Is it 2 hours, 90 minutes, or what's kind of
Yeah.
a cycle?
When we're asking the question of our patients, we say, do you eat within 2 hours before bed?
Okay.
And really within 2 hours is still like many people have a little snack or a dessert or whatever that may be, whether it's healthy or not, that might be what they have 2 hours before bed. Or are you having a full blown Thanksgiving dinner before bed? What's happening there and how are you feeling? The other piece of that too, caffeine. So we have to remember caffeine has a 6-hour half-life. So what that means is that even 6 hours after you had that last beverage, you still have half of the concentration of caffeine in your body. And so patients who are reporting, I have a hard time staying asleep, it actually could be that maybe they fell asleep fine, but that caffeine could be waking them up later in the night. If they have a hard time falling asleep, one of my very first questions is when is your last caffeinated beverage of the day? And so that's a big one that if we can just even adjust that timeline and keep it to the early morning hours, that oftentimes a lot of patients who think they have insomnia, we can resolve that problem just by them simply changing their caffeine habit.
Hmm. 6 hours,
That's interesting.
that's a long time. My kids, somebody was trying to have a caffeinated beverage last night when they got home after school. I'm like, no, Tyler,
Yes. No, no, I know.
I'm
Sometimes we drive up to the mountains usually on a Thursday, and especially in the winter, it's just like, "Oh, I want my nice warm coffee while I'm driving to the mountains," and I don't do it often, but when I do, I just know I'm gonna pay for it later.
Oh my God.
yeah,
I've
that
violated
late,
so many
like I'll
rules.
notice that I can fall asleep pretty quickly most of the time. But if I have caffeine, I'll wake up in the middle of the night or a few hours later.
Yep, yep.
Man, why am I up right now?
Just wired.
Yeah.
Exactly. And then you think about that now, you've thrown off your whole rhythm. You've thrown off all your sleep cycles. Now you're not getting into those stages of sleep for the duration of sleep. And now it's creating that entire problem all over again. So you just start to think of these people where this is happening for them night after night after night. No wonder they're grouchy. No wonder they don't get along well with their family or their spouse, or they're not performing well at work or athletics. Any of these things, all of that is now affected. So I always say that sleep is the ultimate performance enhancer. Whatever you're trying to perform in, if you just sleep better, you're going to do a better job.
Yeah, I agree. And that's why I'm such a big advocate of the PBM. We have this a simple tool that's not hard to do because it's hard for me to not want a coffee in the afternoon, but I can at least get in front of that light and notice big
Mhm.
differences. But that would be a challenge. 6 hours before, I'm not good at that. Like I love black coffee.
I I wish I knew all. I wish I knew all this information when I was going through, through high school. At that time, I would have made really good arguments to my teacher as to why I'm sleeping in class. Because
That's
this is
right.
all about my performance. So tomorrow I can do a lot better.
That's right. Exactly, exactly. When you think about that now, so many school districts are talking about trying to start later, and that's teenagers, they're on a different circadian rhythm than we are as adults, and it changes over time, and so they actually are night owls, and that's natural for someone of that age, and so that's something when I teach this, I actually tell people that to parents of, "I know it's really hard, you don't want your teenager to sleep until noon or 2 p.m., but actually that's exactly what their body needs and wants to do right now. So just let them grow out of it and it'll be okay." But we're forcing it upon them, whether it's sports and homework and school schedules and all of that. That makes it hard for them from an early age to even start to develop those good healthy habits.
Yeah, that is very clear on holiday. We have four teenagers, and it is like we didn't see them until lunch.
Yes, exactly. Don't plan anything before lunch.
Jaden,
My
you, Jaden
3-year-old
has,
daughter, she's
you'll
up
see
at
that.
7 on the dot.
Yeah, our 7-year-old is up. He's the first one. He's like up and about, like fully awake. But the teenagers are, especially I noticed, and I remember that it's been such a long time for me. But I remember those days when, like in high school, I could sleep forever.
Hmm.
And I like now it's like 4:30 in the morning. I don't need the alarm. I'm up, and I'm like,
Yeah,
okay, I can sleep.
yeah, yeah.
Well, it's been amazing speaking with you. I think we're out of time. We're almost at an hour, and
Yeah.
it's been an absolute pleasure. I would love to have more conversations about all the science and the clinical aspects of what we're doing. And there's so much more to talk about, especially the scope of what you have and what's going on. And actually, I have to admit I haven't uh, taken a deep dive the course, but I'm planning to because I'm a
Yeah.
lifelong learner and I want. You've been kind enough to let me have access to that, so I'm excited to learn more. And you've given us so many clinical pearls. It's awesome. So thank you so much for being on with us.
Yes,
Thank you.
absolutely. And always deep dives on dynamicdentalsleep.com. There's going to continue to be more information as we learn more in the industry, but just also just to help everybody to just learn more about the importance of sleep.
Beautiful.
Great.
Well, the sun has popped out in cloudy Oregon. I'm gonna go step. You can see it in my glasses. So I'm gonna go step outside and soak it in for a couple of minutes while
All
it's
right.
here.
Enjoy.
Thank you.
So